When we talk about the spinal disorders, cervical spondylosis, lumbar spondylosis, sciatica, brachial neuralgia, intervertebral disc prolapse, disc bulge, compression, these all are very commonly seen in clinical practice. When we come to the neurological area, the disorders like paralysis, facial palsy, Parkinson's, multiple sclerosis are very commonly seen in the clinical practice. In Ayurveda, these neurological diseases and the spinal disorders are very well narrated in the context of Vata Vyadhi. For example, the paralysis, stroke, facial palsy, sciatica, Parkinson's, these all diseases are very well narrated in classical text of Ayurveda like Charaka Samhita. In Ayurveda, the major causes of all the diseases are classified under three categories, namely diet, lifestyle, and mind related. Especially, all the diseases are arising out of the imbalances and mistakes what we commit with the diet. People are always running behind time and money, and they don't have time to eat. They take the food whatever is available, and irregular kind of the diet, irregular timing of the food. This all plays a major role in development of the diseases. In Ayurveda, we call it as the Agni, the digestive power, which is the basic root cause for creating the diseases. The other area is the lifestyle. For example, with lot of mechanical life, we have to drive for a long distance and we have to work in the night duties. These all creates the increase in Vata, which we tell as a main cause of creating the diseases. Stress also plays a major role, especially in the neurological conditions. The emotional imbalance is the major root cause for creating the diseases. So overall, all these three, the diet, lifestyle and the mind, plays a major role in creating the diseases in Ayurveda. Diagnosis of these conditions are mainly based on the clinical examination by the physician. Ayurveda has threefold way of examination called as Darshana by seeing, Sparshana by touching and Prashna by interrogating. We don't much rely upon the investigations like a CT scan or MRI scan or a blood test, which is secondary to us, whereas we mainly see the patient and then examine the patient to understand. The patients usually come up with the pain as a major symptom in spinal disorders. It can be associated with stiffness, radiating pain or numbness. Whereas in the neurological diseases, stroke, there can be a mobility disturbances like inability, weakness of one side of the hand or leg or the face. So tremors in the hands, for example in Parkinson. So when we see the patient, we will be able to understand what kind of the disease they are with, and we will be able to examine and then understand. In Ayurveda, it is more kind of a personalized examination, which is very essential. In all the patients of the same disease, the treatment will vary according to the patients. Even though the patients are coming up with the investigation nowadays, every patients, they finish all the investigation and then they turn up to the Ayurveda doctor. So we will use that as a secondary document to confirm the diagnosis. The prevention of these diseases are, as I told you before, the basic root cause of the diseases are due to diet, lifestyle and mind. So the people are advised to take a proper diet with a proper timing, as well as their lifestyle has to be modified. They have to have the proper exercise. They have to stop doing over exercise or stretching, long day during the night, working and all. As well as the emotional imbalance has to be corrected with yoga, pranayama or dhyana practices. The treatment aspect of these diseases, as I told you before, these are considered under the Vata Vyadhi, which is the primary area of Ayurveda. We treat these diseases very well and we will be able to manage it. There are a lot of internal medications like decoctions, aristams, layhyams. There are tablets, medicines which are herbal in nature, which don't have much side effect. As well as the external treatments like oil application, podically, elakili treatments, pedichil. These all treatments will be very well useful for relaxing the muscles, bones and strengthening the nerves. Especially in the neurological diseases, we go with the treatments like Shirodhara, Pilichil, those treatments are very well accepted and has very good efficacy in the treatment. Panchakarma procedures like Vasti, the enema therapy is found to have very good efficacies in these treatments. Usually the patient will be reaching to us at the last stage after trying up all the treatments from all the different system of medicines. So the treatment will take long time for us to deliver the proper result. But when they try to approach for these kind of the diseases at the earlier stage, we will be able to manage it very well in a short duration. Ayurveda was the mainstream of treatment in olden days. But nowadays the people tend to go to the other systems for all the therapies, and then they tend to come to Ayurveda at the last phase. In my opinion, if the people are able to approach to Ayurveda treatment for all the diseases, especially the area where I have spoken today about neurological disorders and spinal disorders, Ayurveda has better result. We will be able to really do well and then improve the patient and do the better outcome within the shorter duration. So now the awareness towards the Ayurveda has improved a lot, and the government is also trying to support the system to grow very well. The public has to come towards Ayurveda more and more. Thank you for the session, and thank you for Ayurveda community. Jai Ayurveda, live Ayurveda, love Ayurveda.
SG Ayurveda Hospital and Research Institute, Periyanaikapalayam, Coimbatore.